on our PATH CPI? Perfect. All right. So we want to go over, where these maps are coming from with some high-level survey results. And then these maps were created in a program called Kumu. And so Sean is going to give you an overview and tutorial of how to navigate these dynamic assets maps in Kumu. And then we're going to be going over use cases, essentially specific examples of how you might use these asset maps for strategic planning or in your everyday work. And of course, time for questions. So we want to increase awareness of our regional assets and who is engaged in the Medi-Cal delivery system. We also want to demonstrate these use cases or specific examples of how to use our asset maps to support our activities in this Medi-Cal delivery system that we are all engaged in. Next, please. All right, wonderful. Here we are again for the recording. We have our pop-up training for our PATH CPI asset mapping demo. And I'm going to go ahead and turn it over to Sean, who's going to go over the survey and where we've gone from there.
Good morning, everyone. I figured before diving into the asset map demo, I know this might be some people's first meeting potentially, and regardless of that, I thought it would be a good idea to just kind of start with the background of how we got to the asset map. And so I thought it would be good to just kind of remind everyone about the survey that we disseminated in March on the PATH Collaborative Planning Survey. The purpose of this survey was to help inform cross-sector care coordination in both the Northwest and Southwest California regions. How? By informing collaborative planning and planning among cross-boundary partners, and also with the goal of essentially creating this asset map. This asset map and the survey questions included information such as the sector that organizations were in, the type of organizations that they were, what type of services they provided, including but not limited to community supports, enhanced care management. The asset map will include different types of providers, information specific to even the electronic health records they use, care coordination platforms. We asked survey questions specific to their capacity to provide different services, and essentially a bulk of a ton of other resources that any organization might provide. And so the survey, again, was administered in March of 2023. We presented a high-level summary in our April convening where we showed the results of the survey and the inputs into the map. We had 37 organizations complete the surveys, but we were able to use some of the information from some organizations that partially completed the survey. We had 10 organizations from Lake County, 8 in Marin, 12 in Mendocino, 10 in Napa as well, and then 17 registered in Sonoma. And so that is essentially what is feeding into the asset map that I am about to demo. So stop. Sorry, I'm not supposed to see that yet. Okay. Can everyone see the map on my screen? Lovely. Okay, if someone could pop the link to the map in the chat, that would be great. I know some people like to follow along as they learn. And so if you want to click that link and get the map up on the second screen, if you have one, that's a good time to do so. I will do my best to slowly present this information. I want this to be as interactive of a training as possible. And so if you have any questions, please stop me when I'm screen sharing. Sometimes it's a little challenging to see what's in the chat. And so I'll ask my team to be please mindful of the chat and stop me if a question is posted there. And for others, literally feel free to interrupt me if you have a question that I would do my best to answer. And so when you click the asset map link, it'll bring you to this default page, this big, beautiful US map and a ton of organizations and lines and labels and information connecting them. And so I want to first start with the info page on the left. This essentially, at default, will have a summary that we added for what this map shows, a little instruction section for how to get around the Kumu map. Sorry, I am doing that. And then just some more helpful links as well as contact information in case you have any questions. And so if you are done reading through that and you want to start digging through the map, the first thing you need to do is just click literally anywhere on the map. It'll make the information pane go away. To move around this map, it's simply clicking and dragging. If I want to go to the right, I click and drag to the right. If I want to go to the left, I click and drag to the left. If I want to zoom in on a certain locale, it's just scrolling on my mouse. For me, I'm on a Mac, so it's just 2 fingers up and 2 fingers down. If I want to zoom in anywhere else, click and drag to get to that location. You can really zoom into very granular detail on this map, which is really nice and nifty. Let's zoom back out now. And then the next thing I would like to show is, all these organizations on this map contain information. They also contain varying levels of information. As I said earlier in this presentation, we disseminated a survey in March where we asked a ton of questions related to the capacity, knowledge, and resources that each of these organizations have. Not every organization that's depicted on this map was able to complete that survey. And so you will see some organizations have more information than other. And so just to use one example here, Partnership Health Plan completed the survey. And so they have, quite a robust list of attributes available to them. And if you come to another organization, you'll see, okay, they don't have as much listed. They weren't able to complete the survey. And so our team essentially used what we could find publicly available to us to fill as much information as we possibly could for them. And then for organizations that are registered in this collaborative, we used information that they provided upon registering to add more attributes to them as well. And so that's just, when you're going through this and you're noticing that, I just wanted to give the heads up now. Another thing that I wanted to call out are called custom controls. In my top left corner, you'll see 3 different controls here. The first one showing linkage type, second one showing location, and then the third one showing please describe, check what best describes your organization. And so to use linkage type as an example first, all the connections in this map represent, and again, connections are essentially all the lines between different organizations, represent 3 different connection types. Collaboration. In the survey, we asked them, did you collaborate with? Let us know all the organizations that you collaborated with. And so if someone reported that they collaborated with each other, they have a connection. There's also connection for data exchange, where we asked the question, let us know the organizations that you sent or received data from. And then thirdly, referrals. Let us know which organizations you sent referrals to or received referrals from. Just want to call out the default setting of Kumu, which is not too much straightforward thing, is when nothing is selected here, it means all of them are selected. Also, if all of them are selected, it also means all of them are selected. And so I know that can be a little confusing. So right now, all of them are selected. You see nothing changed on my map. If I go back to there and unselect all of them, nothing changed on my map. It means essentially I'm not filtering by a specific thing. But as soon as I change it, and I am only interested in organizations on this map that said that they refer patients within each other. If I click that, you'll see some of my lines went away. I don't know if I'll do it again. If you look on the map, you'll see some of the lines disappear. And so the connections that are currently on this map only represent organizations that essentially said that they refer patients between one another. Let me uncheck that. It goes back to all of them are selected. Now I want to focus on just organizations that share data with one another. A lot more lines went away, and you see, who is currently sharing data in the Southwest region of Northern California. And then another one is location. You can filter by location again. None of them are selected. It means all of them are selected, but this is by county. And if I'm If I'm curious, just want to look at things in Alameda, if I check that, it only shows me organizations that are registered with the location in Alameda. Doing it again for Calusa and so forth. You can go through this entire thing and do that. The only downfall of doing that sometimes is when you filter by a specific location. I'll use Marin, for example. It'll only show organizations in this county, but you won't be able to see all the connections that they have with organizations from other counties. And so just being mindful of, filtering by this is really mostly useful for just seeing who in this region, who in this county is listed on this map. But to get the bigger picture of things, you want to be able to see like who else they're all connected with. And so these aren't the only three controls that you can have in Kumu. If you go to the settings on the top right, it is this gear icon here. You click it, it'll bring you this pane. And those controls that I had in the top left, again, linkage type, location, what type of organization you are. These are things that I added and made as the default for the map. When you're going through the map, you might be interested in other pieces of information like, oh, maybe I'm curious about, I really want to be able to filter easily by the services that are being provided. And so you will come to the settings button here, again, top right, go to add custom control. There, as you see, there's a ton of functions in here that essentially more or less end up showing you different ways to filter by different things. But I think the most straightforward one is adding a custom control. Click add a custom control. It'll bring you this pane showing control, region, by, and X. And so the first one is filter element by. An element is essentially any node or organization that is on the map. And so I am going to be filtering my elements or my organizations by a characteristic or variable that is in this map. Region is essentially where do I want that control to be? The default is in the bottom. I prefer having things out of the way and not on the map. So I always put mine on the top left. That is entirely a thing of personal preference. And then by element type. And so this will bring up all the variables that you could possibly filter by in this map. For this example that I'm demoing, I believe I said, I'm curious and want to be able to filter by the services provided. And so I'll find the variable that I want to click it, services provided, and you'll see it kind of just all the different possible services that we allowed people to report in the survey, kind of just like lump that in the map. It's kind of messy. I don't like the way that looks. And so I make all of my custom controls labels. I'm sorry, not labels, drop down. And you'll see that it kind of disappeared. It's if you go back and then exit out of the settings, now I've got a new control in the top left corner. And so I can not just filter by the linkage type, location, organization type. Now I've made it easier for me to figure out, okay, in terms of my day-to-day use cases, I'm interested in organizations that provide a specific and certain service that I maybe want to refer my patients to. I can do that here and it'll stay that way. And again, you don't have to put it in the top left corner. You don't have to make it a button, but some of the variables that are in here, which is like services provided, EHR, care coordination platform, that have a longer list of options. I like having it as a drop down just so it's not covering them. And so I will stop there for now to ask if anyone has any questions.
There are a couple questions in the chat, Sean. One is, how can we add organizations that are not present? I missed a couple of meetings and the Napa organizations are not present except for the county. Can the survey still be completed?
Okay, so that is a great question. Unfortunately, we have closed the survey. We kept it open until the end of April to give organizations more time to complete it. We are brainstorming a potential approach of linking the data set that are feeding this map to a Google Sheets. That way we can share that sheets and potentially give ownership to the collaborative so that any new organization that joins, whether it's yesterday, this week, next week, can go to that linked document and add in their information into essentially a Google Doc. So they can add in their organization name, their address, they can add in, their services provided. But that is something that we are currently in the works of developing. And so stay tuned for that one. But we do currently welcome you sending new information like that to our PATH CPI email as well.
And if I can add as well, we have another helpful comment. Thank you, Aura. PHC has all of our information. Not sure why they are not here. Totally understandable. So the survey was sent out earlier this year. And we know that PHC now has their helpful provider directory, which we'll also share a link to at the end. So the data sources are different. And we'll continue brainstorming about how to best make sure information is shared across.
Are there any other questions?
Sean, Aura has her hand raised. Go ahead, Aura.
Yes, hi, good morning. I was just wondering, I know for me, I attended a couple meetings when this got kicked off, but I didn't realize I had to do a full registration. And so I missed a couple meetings because I wasn't getting any notifications. And even now I'm totally registered, so I get the reminders, but there's no actual appointments sent out. And I know that my colleagues here in Napa County, Ole Health, Abode, some of the other organizations that are joining our ECM group and community supports. I don't know that. I'm just trying to figure out what the best way is to ensure that individuals have this information to be able to join these meetings. Also, Providence has representation in Humboldt, Sonoma, and here, and I don't see them also on these lists. So I just don't know if there's something that can be done as like another email to go out, or, I've shared as much as I can, but I myself missed a couple of meetings, even though I thought I knew, when the meetings were, because they weren't on my calendar. And as calendars are super full, like just now I've put a placeholder, so at least I know it's coming. So just a thought of like, would you consider sending appointments out if you already are registered for a specific region? So just a question.
Yeah, thank you. In terms of sending out meetings, we recently updated our cadence and making sure that newly registered participants would also receive calendar holds that we had given earlier in the year. So we'll revisit that and make sure that you've got that information and that those are being regularly updated for all of our newly registered participants. And that's really helpful feedback to confirm that that is something that we needed to address. So we've started that and we'll continue to fine tune that and make sure you're attached. And then if there is not information from your comments, and also Melanie is asking, does this mean the tool being presented will remain static and won't ever be updated? No, we're just working on how to now integrate new data into the source of this map. So please email the path@pophealthinnovationlab.org address that Jessica put in the chat, and with any concern ever or idea. But if you have information that you want to be added to the map, let us know. We'll keep that list and update you with the process. And then also, if you want more of those calendar holds, which we'll be doing automatically. And then Jessica also put the form there for communications. So is there anything that I've left out?
Yeah, and I'll just add to what Rachel just said, Melanie. We are working on updating this map, and not just us updating it, ensuring that 5 months from now, 6 months from now, a year from now, it's something that is a dynamic and live map. Our first step that we're trying to work on with partnership is essentially getting their list of all registered ECM providers and community support providers in an Excel file, so we can add all those other organizations onto this map, so you have a more robust location of finding who's doing what. And then again, like I said earlier, our goal is to have all the data that is feeding. And it's just a really simple Excel sheet that's feeding this map, having it on a readily accessible Google Sheet somewhere, so that those that are in the collaborative, as they want to update, let's say you are one of the organizations here and you want to change the services that you provide, you're no longer providing housing services, you're able to go in there and go, remove it or add a new service that you provide, so that this is as useful in real time for you all as possible. Okay, if there are no more questions, I will keep going. And so I think something that I kind of forgot earlier that could be really useful, given how many organizations are currently on the map and expecting a lot more to be added, is the search function, in case you are looking for a specific organization. If you're clicking anywhere on the map, just press S, you'll see the search bar come up. And so I like to use partnership. Health plan, again, as an example, I start typing them and Kumu will scope in on where they are, and it'll also pull up their information. Yeah. And so that is essentially the the basics of Kumu. I will demo just a few potential use cases and then leave it for questions after, for people who want to see maybe specific things or ask of what is possible and what's not possible. And so, like I said earlier, one really simple and rudimentary use case here is just seeing the types of connections in your region, or maybe you want to scope in and see in your county. And so instead of filtering by, I think red is, this is Sonoma, instead of filtering by Sonoma, I can just zoom into the Sonoma region and go, who here is exchanging data with each other, and I can see that. This is, again, super high level use case. Who is referring between each other, in terms of like being potentially a case manager or a provider who has a new patient that's seeking a new service that maybe you don't provide, or you want to refer them to another provider. And so let's say I am a ECM provider who is maybe maxed out in that capacity, but I want to refer this patient to another ECM provider. I can go to the services providers control. And again, this has about 60 something different services in here, all ranging in a variety of topics. And so let's say, again, on this example, enhanced care management, I want to refer them to somebody else. I can, now this map is, not everyone saw that. So this is what the map previously looked like. And now that I'm filtering by this service provided ECM, now all that is on the map are those that have indicated that they are ECM providers. And so let's say I am a provider in Sonoma County, I am at capacity and not taking on new patients, I can refer them to somebody else. Or let's say a very similar use case, I am a provider in Sonoma who is not a housing provider, but my patient needs to be connected with someone who is a housing provider. I can, again, in the services provided, come filter by, housing assistance, housing deposits. I will select all 4 housing variables, and I can see who is doing that, not just in my county, but also across the state as well. So, and then another way to use this map just might be to see service gaps in in your region. Let's say, again, just to stick with, for the sake of ease, ECM provision services. In the map currently, I'm seeing that there are 3 different organizations in Marin County that provide ECM services. In case you have you don't want to be referring a patient to somewhere that's maybe a little too far away for them, and you want to refer them to somewhere that's like easily accessible. This would be another use case of this. Let's say I'm Seneca family, and I want to refer my patient to another ECM provider. Again, I could potentially refer them to this too. And I think, honestly, one of the biggest use cases of this map at the organization level is seeing, one, who in your county, who in your region is doing what. what services are they offering, and then being able to use it to essentially refer patients to other services that they might be needing that you currently don't provide. And again, I could demo this use case for a ton of different things, but I think that'll get a little repetitive. I think people might get the idea here. I will leave it for questions for this at this point. If you have any questions, that would be a great time to ask. Melanie, would you be okay adding a little more detail to your question? Is there a plan to try to integrate services across counties? We often serve patients who live in one county but receive care in another county. Okay.
Yeah. Thanks.
I'm curious to know what other people think about this question, because one thing that we've heard over time is that there is a lot of work happening within counties, and that maybe this regional designation doesn't always make sense. And one thing on the field team we were thinking we would see from this asset mapping is that there is a lot of interconnectivity across counties. And even if this kind of, DHCS designated region doesn't make exact sense, that there is a lot of potential value to thinking about integrating services across counties, and just understanding that that is already happening to some extent. We've heard a lot of different perspectives on this question over time, and I'm curious to know what you all think after seeing this map. After seeing this map and seeing empirically that there are cross-county connections, what do you all think? Is Melanie's question, is this the plan to integrate services across counties? Do y'all think that this is needed? Is more attention deserved here? Nancy?
Well, I'm wondering if that really is referring cross-county, or if it's like, we work in 2 or 3 different counties, and yeah, we're working with these organizations in this county and these organizations in this county, but I'm a hub, so it's going to show me working with organizations across counties. So I'm curious to know, does that mean where organizations are referring cross-county, or is it more that an organization is multi-county?
Great question, Nancy. Melanie, I'm curious from your comment, it seems that your organization may be serving across counties and not necessarily be a multi-county organization. Is that right? Or what's the context that you're seeing?
Yeah, that's true. I mean, we're an FQHC in Marin County, but we often have patients who live in different counties. And I know this has come up for us at times where we're really trying to facilitate services across counties, and it's challenging.
Yeah.
Can I add?
Yeah, go ahead, Stephanie.
Sorry, Stephanie. And I think this is a great conversation, because I think both scenarios can happen a lot, where you have organizations that work in multiple counties but might serve patients or participants or clients in one county. But also, when you're working with these complex and vulnerable populations, they can often move from county to county fairly often, especially if it's unhoused populations and it's very difficult to find housing, or just people with high needs. Maybe the closest clinic, it is a Marin clinic that's not, and they don't live in Marin. So I think both scenarios are very important. And I think what Stephanie probably wants to say, Stephanie Baltima, is that what's most useful to all of you, that's going to be what's important. How do we make this map so that it is really helpful to your needs as we move into this enhanced care management world and community supports world, so that we save you time and create more efficient care? That's it. Yeah, the housing thing is the real challenge, Cayenne, right? Exactly. And then they may have to switch providers. So we all need to get better at communicating with each other and not being just in our own counties and thinking that populations are stable, because really with what housing has become, or the lack of housing has become, really folks aren't stable. And they're not going to stay where they are. And they may love their primary care practitioner or get really connected to their social service providers or their county health providers, but they may just need to move because it's the only way they can find housing. So the question is then, how do we become more flexible as social service providers or primary care providers? And how do we just become more efficient? Because there are some systemic just challenges or barriers to our data systems and other things like that. But as a Phil team, we want to be able to help you make that work better or give you the information you need, which I think Sean and Stephanie and all of us are working to do in whatever way possible.
Any other questions about information on this map, or what you can maybe try to do, maybe not do on the map? Yeah, I'm gonna take it that you are all Kumu mapping experts now. And we'll have, I'm just kidding. If you have any questions regarding the map after this, obviously you are more than welcome to reach out to our PATH email. My contact information is in the information pane of the map as well. If you have a little more technical and how-to questions, I'm always available and eager to answer your questions. And again, just to circle back, I think one of the biggest things that will make this map even more useful for all of you is us working with partnership to get a more robust list of all organizations that are providing different services, ECM, community support, and adding them to that. And then again, enabling individuals to be able to, if they don't see themselves on the map, to add themselves to the map via Google Sheets. And not only that, just for all types of providers who have access to this map to be able to edit and update their information. So it is a, for lack of better words, living and breathing tool for what is actually available as resources in your region and in your county. And I think I will hand it over to Rachel now if we have no other questions to close this out.
Laura, your hand's up.
Yes, quick question. When I logged into the map, I noticed that the fourth option of services provided, I don't have available, and you may have said something about that earlier that I missed. Do you have to like create an account to get that, to have that
And
available?
so this is that, because I'm still in the map and have not reloaded the page, it's not, you're not going to see it yet. I just added that as an example. And so the default that you will see right now is these three, but as soon as I reload this page and you reload your page on your end, you should see the services provided option. Also, let me cover this. Sometimes when you log into the map, Kumu will put you in the middle of the ocean. Nothing is wrong. This actually took me some time to realize that's like, where's my map, where it's going? It is super zoomed in on the Pacific Ocean right now, basically, or Atlantic. My geography is not the greatest. You just need to zoom out, and then you will see that the dots are kind of like awkwardly floating in the ocean as well. But as you zoom into where you need to zoom in on, Kumu will fit them to the correct place. And so for some people who might try to do that right now, if your skin is blue, it's correct. You just need to zoom out and then maneuver over to the right place. But I think it was Aura whose hand was up. You should be able to see the services provided option now. And again, if you cannot, I will show you again really quickly how I added that. These again are called custom controls. They're in the settings pane. Essentially, you are adding a control, basically a way to filter by a variable you're interested in. For me, services provided was high of interest. So by element type is the variable. You go to the variable you're interested in, services provided. And again, it defaults to having them like this. And I just don't like that that's super messy because there's 60 something services here. So I made them a drop down menu so that I can filter this way instead. And so that is how you add your custom control. And again, I moved mine to the top left just because that's my preference. You can put yours wherever you want to as well. And so you don't have to you can add a lot more variables to these controls. There are variables such as, again, if you're interested in like care coordination platform, that's something you can find in there, add it there, and you'll be able to filter by the different care coordination platform. For an example, if you're, trying to partner with someone new and you want to make sure that maybe your systems are able to connect with each other, just another use case to quickly grab it. But you should see the services provided now, and if you do not, you are able to add that on your end as well, along with other variables of the system.
So Sean, can I just clarify? Oh, sorry. So each of us, if we want services provided to be in our upper left-hand corner, like you just went through that series of steps, we would need to do it, each of us individually, when we go into Kumu.
Because I've done it now and I'm the math owner and I have and I've reloaded the page. Anyone who now uses the link will see these four. But if you want to add anything, any of the other variables you're interested in to here, you will have to go through what I just did to add what you are interested in looking for.
Okay, thank you, map owner, because I think that was really useful. It looks like that's a good one to have.
That is a good one to have. I did not include it earlier just so I could use it as a demo, but now it is permanent. You will not have to repeat that.
Thank you so much. I'm going to stop our recording. That is a good place with all of our overview.